Okay, so listen, yesterday, last night, we did the video. I did the video twice and it did not come out right. But I don't know what happened. I had something else on and that's why it didn't come out right. Okay, so this is 4 and 5. We are reviewing 4 and 5 again from yesterday. Let me add me back to the stage. So next week, this is Monday. Okay. So Monday is 5 and 6. Okay. So Monday is going to be chapter 5 and 6. Okay. Tuesday is also going to be 5 and 6. Okay. I had to put Tuesday in there because last week we had that on the schedule, but your normal schedule is going to be Monday, Friday, and Saturday. Okay. Here's your regular days. Okay. Friday, we're doing chapter 7, chapter 8, Saturday, chapter 9, and chapter 10. So you guys see how we kind of get through this really quickly. You see how we're doing the schedule, right? And unfortunately, I did two chats yesterday that was absolutely amazing, and I had to take them off because y'all not gonna believe it. I had to Zoom on and that on at the same time, so that's what was affecting the audio. All right, so I'm just going to go over a little bit of what we're doing this week. I'll fix that schedule for next week. This is this week, so I did have to take those two videos off we did last night because the audio was a mess. So this is my third try doing this, and I think I got it. So I have to pay more attention to what I got the Zoom on or this. So that's pretty much what happened. So I don't care. Let's roll it. Let's do it again. So Monday we went over 1 and 2. We went over 1 and 2 Monday, right? Friday 3 and 4. That was yesterday. We did do the 3 and the 4. Okay, we did do all of those sessions, but we're going to do them again this morning because the audio was not good. Okay, so tonight, that Saturday is for tonight at 6 o'clock. I'm only doing this because of the mishaps that I had from yesterday. And trust me, I would never let it go. I could have just still put it out there. But that's not fair to you guys. You're trying to watch something, you can't hear me. My audio was a little bit crazy. So again, Monday, Friday, and Saturday is your normal class, okay? And this is your schedule. You guys can look at any one of these chats and go over those schedules, okay? And you can pretty much see what's going to be in there. So let's go ahead and also put up, let me see what we got up here. So the books. This is the books that we went over yesterday because a lot of people want to know which books they want to, that they need to get. So you can get it from Amazon, you can get it from AAPC themselves, or you can just go to AMA. If you do go to AMA and get your books, the link is going to direct you to Amazon. So you guys know that we are in medical insurance billing. And medical insurance billing does have two coding portions in there. That's what we went over last night. So I'm just recapping what we did last night because I'm sorry, I had to pull those videos because you guys could not hear me on the video. So this is the third time I'm doing the video. But I don't care if we do it 5 times. If y'all get it, y'all got it. So even if you don't have your coding books, just get your paper and write down what you need or backtrack over this. So you guys see the ISBN number right here? That's for the CPT 25 in case you decide to get the book from someplace else, okay? The ICD-10, this is the ISBN for that. I prefer you to get the AAPC one because the exam is coming from how they derive their book, okay? HCPCS, here's your ISBN for your HCPCS book. Okay. Now, you guys see my books, Buck and them. They have the same type of books, but they're just a little bit different. But for your test, I want you to get either the AMA or AAPC. So your ICD-10, AAPC, HCPCS, AAPC, AMA, CPT. Okay. So let's keep going with the books. Next slide. So this is what we are working on right now. Okay. Don't forget to go to thrifts.com. Okay, go to thrift.com for this. All right. You need your workbook and you need your reading book. You're going to read a chapter, then you do your exercise in your workbook. Okay. So some of you who didn't get a chance to look at this last night, this is what we're working on right now. I work from a crosswalk. It's a real program. This is the book that we're working in right now. Okay. Step by step. Your step by step book is the book that pretty much you can get like the first 50 pages free. And don't forget, I put the link up there for the Kindle. But the step by step book, this is your go to. These are the books that you need to do a medical insurance billing course. And remember, my course is independent. I don't need to hold your hand to do this course. I'm putting you in the right place. You need me, you need a question, just for YouTube. You guys have to send me a message and I will get back to you. Um, Especially like on Saturday morning, like now, after I have coffee and everything, I'm pretty much abreast. But night, I'm pretty much an early bird, but I've been extending my night so I can make sure I get this into you guys 6 o'clock and have that consistency for you guys. Just remember, you don't need to get the books all at one time. Take your time and get the books. That thrift.com or any other one, you can use those and you'll get the book a lot cheaper. Like I said, if you go to Elsevier, you can get books from there. Amazon also has step by step. I don't know if they have 2025, but they should. Okay, they should. Okay, let's keep it moving. So this is your language of medicine book. These are just different years. That's the 12th edition. I think the other one is the 13th edition. You guys at Sapphire have the 11th edition. I can't put that on the YouTube for you guys, but if any of you YouTubers want that book, those of you who are in my classroom or learning the medical billing, I will send you the link for the free book. Because this book is $112. You can go to Thrift. I would go to Thrift because thrift.com, you might get it for $10. You're not going to get a new one, but you do not need a new book for language of medicine. Why, Miss Lambert? Because language of medicine doesn't change. The only thing they do to this book is change the cover. It's so invasive. I can't put, pictures from this book up here. Maybe tonight. Maybe tonight. I was told I can screenshot. That's what we did last night. We apologize because I had to do that video but twice last night, and I just took it off because the audio was crazy. I can't stress that enough. So don't think we was not on last night. We were on at 6 o'clock. Those of you who got in on it live, you probably couldn't hear me. And that's terrible when you can't hear me. That one, if I'm not satisfied with a video, I want y'all to know right now, I remove it. I gotta remove it unlisted or whatever we do. We just gotta get it fixed. So these are your language of medicine books. Okay. So we went over all of the books. What I'm going to show you is just a whole list of the books after we go through this. So the next thing that we went over last night is what we are going to go over. And this is, okay, I'll be forgetting. You got to take this down. And then to take this down, then I go back. So I don't know what happened right there. Okay, so let's look at the schedule. So this schedule is also for you guys. It's not just for, Sapphire. For the YouTube class that I made for you guys, your course is a little bit different than the Sapphire students in the portal. But I truly hope you can hear this. I fixed everything where there's nothing wrong, nothing incorrect about listening to this. Um, so if you already have a language of medicine book, I have flipped the schedule in case you do not have your medical insurance billing book, which costs change. But you can get it. $30 is change if you don't have it. So, I would just check, like I said, thrift.com or, Amazon. When you catch Amazon at 4 o'clock in the morning, they have like 30 and 40 off for some of their books. Okay. But as you can see, this is the schedule. This schedule is for YouTube. Okay. Sapphire goes by this same schedule. And it's not really a schedule, it's just something to keep your YouTubers on track. Okay. So remember, this is YouTube University Medical Billing and Coding. Everybody is on the same track. Okay. Look, same thing in your language of medicine book. Okay. Same thing. This is what you would go over. And the reason why you're going to use this, because you guys can keep up with what you're doing. If you're doing chapter 1, basic word structure, put the date that you did the exercise and put the score that you got. Okay. The answers are in the back of your book. If anybody on YouTube does the full exercise, you only have like all the even answers. I have the teacher's book. If you want me to check those for you, I will check those for you, the ones that are not in your book. Okay. But again, Sapphire, we go through all of these chapters. Okay. We go through all of these chapters. What we're working on now is the true schedule for the Sapphire program. This is the medical insurance billing. See, that's the medical insurance billing. This is where we are starting from. Okay. So the first chapter is role of an insurance billing specialist. You remember we did that last week. Monday. Okay. And 2, HIPAA compliance. We went over that. So every time we start a new class, I always kind of backtrack on what we did before just to keep you abreast on what we did before. And then we will start on with the new class, which we are doing 3 and 4 tonight. Okay. So again, you see where it says exercise? You could do the exercises in this. This is for the YouTube people. When you do a chapter, do the exercise. That's the reason why you need both books. I'm gonna backtrack on that book real quick. Let me see if I can get it, yo. Because I want you guys to make sure. All right, so I just want to go to the book that we have. I guess it goes down, but sometimes I can't get it. Hold on, y'all. Oh, there they are. So I have to I had to backtrack to get you. Okay, so I just want to do this because I want to show you guys the book. I can't stress enough the kind of book that you need. Now, the book that are older, they may not have this name on it, but it is still the Fordney book. This is real tiny, so you cannot see this. I'm just going to go into shared screen real quick, and that's because I want to show you the book. So, and I'm just going to backtrack. I was just in it, so I got to sign back in. Hold on, y'all. Y'all can't see this, but I need to go to my library. So my library has everything in there, and they got new terms and conditions. So give me like a second. And the reason why I want you guys to see this because when you're looking at this on your phone, you could hardly see. I can hardly see it on my phone. Okay, so now I'm gonna go back and I'm gonna drop this one up because I have to make sure that you guys know which book to get. So you see this one right here. This is the one you will get. Okay, it's same tiny like it was before, but it will not be. It doesn't have to be a new version, but as long as it's by Fordney, her book is par. Every college uses Fordney. She has the only book with everything in it. So in her book, that's the one that you're going to use. Okay, it might say handbook for the medical insurance coders, medical insurance billing book. So if you don't get the new version like this one that I'm showing you right now, just know that the book it has to be from Fordney. Fordney does update whatever federal rules go on, whatever Medicare changes. Fordney update that. Okay, so just be kind of precarious of that. Okay, so So let's go back to the schedule. I just wanted to make sure that you guys are familiar with that book, Fortney Medical Insurance Billing. Okay. And the names are all on that list that I just gave you. And remember, I did a video with the books. It's going to say books. I also put the link in there. And a lot of the stuff that I did before is, which is that I still do, is educational in a nutshell. This is we are doing a regular class. This is class this morning. Okay, this is Sapphire physician coding class this morning. Make sure you guys are archiving this. And this is the back chat from last night. Okay, so the new chats for the new YouTube class is Sapphire ED CLS. Okay, so when you see Sapphire ED CLS, 1, 2, 3, 4, you go here. You come in on today. Then what you gonna do? Which class did I miss? CLS 1, CLS 2, CLS 3. That's what you know you're gonna look at. Any other videos and chats that I've done, it's Sapphire ED 4567 or 429 or 335 4. That's how it goes, even though it still goes up. Okay. So just be precarious of that. Okay, so here, this is medical insurance. Okay, this is pretty much the chapters that we went over yesterday, but we're gonna go over these today. Okay, this is still part of your medical insurance billing. This is just a whole charade. This is the whole course in a nutshell. This is what you're supposed to be learning in this course. Okay, medical coding. This is what you're supposed to be learning in medical coding. You guys see right here where I have 5 and 6. That's the 5 and 6 that I took from the medical insurance billing book, and I added it to the coding. But because some of you guys don't want to do coding and you just want to do medical billing, I put that back into this schedule. I put that back into the regular schedule that you guys saw before. Okay. Let me just go to what I'm talking about. You see, I put that back into this schedule. So 3 and 4 is where we're going to see that at. Okay, 3 and 4, what we're doing today, the ICD-10, the coding, and the HCPCS. That's what we're going over right now. And that's because it's in the medical insurance billing book. I don't think you can pass that test without having medical billing knowledge. Okay, you have to have some type of medical billing knowledge. And we're knocking this out in 2 to 3 weeks. Okay, 2 to 3 weeks, we're knocking this out. With the books, I can't put like word for word, but I can put you in the right place. I was told as long as I do a screenshot, I think we're pretty much okay. So what we're going to do is just continue on. And then again, I can't stress enough the books that you need to use, the checklist that you need to use, and the schedule that you should go by. Now, there's no time limit. I mean, you don't need to take 10 weeks. If you want to take 20 weeks, you want to take as long as you need to pass this exam and to get this into your head. Because even if you go to a hospital and you want to do billing, they're going to give you a billing exam. They may say, show me how to do a deductible. Show me how much the patient is responsible for after you do an 80-20. So yeah, you still need to have this. At my course, they get certificate when they are finished with my course. You have some hospitals that say, how long did you do? What did you do? And yeah, they're going to have you demonstrate your skills. Same thing for coding. If somebody hires you, like I hire, whether they have it or not, I hire based on, can you pass this test? That's what I hire on. And I give them 90 days to actually take their CPC. Some people do, some people don't. Hospitals will also do that. But hospitals have to go by accreditation. They have to go by those rules. Some physician offices, they own their business. So whatever they set for their office, that's what they do. That's what they do. It's not a law that says she has to be a certified professional biller before she codes. If that was the case, nobody would be coding in a hospital that doesn't have a CPC. So that's not the case. Having your CPC is a mastery level. That is the case. Accreditations, they made a decision to say, if she's going to do your coding, we want to make sure that she is at the mastery level. Okay? So that's the purpose of that. All right? That's the purpose of that. There's no, there's no law book that says she needs to be CPC certified. No, she let us know she's a master. Let her go ahead and take that test if she can pass. Okay, it's just like college. There's no law that says you have to go get your bachelor's degree. It's the law. Get it, or we're not gonna hire you. No, that's preference. Just like my sister couldn't get higher up position unless she had her master's degree. Did she now has a higher up position because she knew it was a tit for tat. Either do this or we ain't giving it to you. You see what I'm saying? And that's based on them because they gave her a higher up position, but she wouldn't be able to keep it unless she got that master's degree. So during that transition of her even training for the higher up position, they let her get her master's degree. You see what I'm saying? That only took her 2 years to do. So it's kind of like the same type of scenario. All right. So let me go back to. So you guys can still see me, but I'm kind of navigating through the books. I'm going to open up Fordney's medical insurance book. Okay, make sure your medical insurance book is by Fordney's when you get it. Okay, so we are going over chapter 1, and we're just going over chapter 1 because we're backtracking. I'm going to share my screen with that. Okay, so chapter 1, this is what we did last week. Okay, so this is for YouTube. This is for the YouTube University. Sapphire, you guys have already done this. Okay, so role of an insurance billing specialist, privacy, security, and HIPAA, compliance, fraud, and abuse. This is what we're going over today, YouTube. And wait, let me retract that. We're just backtracking this. This is 2 minutes. We've already done this. All right, so this is chapter 1. Okay, and I'm just pretty much showing you guys what we did last week. I'm not going to go over that thoroughly because we've already done that. Okay, so chapter 2, introduction to health insurance. Let's take a look at that screenshot. Okay, so introduction to healthcare. Now, basics of health insurance we did. Insurance plans we did. Blue plans we did. Medicare we did. Medicaid we did. Don't forget, this is your workbook. Okay, that's where you're going to do the exercises in. Sapphire, you have tests from me to do. YouTube, you will work from the exercise book. Remember, I just did it. The workbook and your book that you're going to work in. Okay, so I'm expecting YouTube to have done this already. This is why I got a lag for YouTube for Monday to Friday. So YouTube, you guys have to complete all of this. Like I said, if you have something that you want to send to Miss Lambert and you want me to grade it for you, I will grade it for you. It's just I haven't figured out yet how I'm going to grade a YouTube yet. Okay, so we'll figure that out. We'll figure that out. And this is just for some of you who want to. The gist of it is what I would do, YouTube. Do the work. Do the work that you're supposed to do. If you want Miss Lambert to give you a competency after you do, let's say, medical insurance billing, that's the only way I will know if you are ready for medical insurance billing. I will give you that competency at the end of your course. At the end of your course, you too will get a competency, and this competency will tell me if you're ready to do medical insurance billing. If YouTube passes this competency, then you're ready. If you want to move on to the coding, you must pass the competency. You cannot move on to coding. Okay? You cannot. I can't say you cannot. You shouldn't, because I want you guys to work independently. So the book, the workbook, the test, the summary, the competency. All right. So I'm going back into the book. So we just showed you, I'm just going to put it back on the stage real quick. Introduction to health insurance. Okay, that's what you guys did last week. We're done with that. Now we are going on to this one. Okay. Documentation and coding. Documentation and coding for professional services. So YouTube, this is chapter 3. This is what we're on this week. Okay, this is what we're on this week. Medical documentation and electronic healthcare records. Okay, ICD 10CM, session 13, CPT coding, 14, HCPCS level 2. Let me just say, if I was in my classroom, if I was at work right now, and I was in my classroom, I'm ready to start my class, I usually have coffee or bring cake or something in there for my students. That's 1. 2, I would be doing exactly the same thing that I'm doing right now on this YouTube. This is a real course. This is not me just throwing something out there. I want y'all to stay coordinated. This is what we are getting ready to do today. Okay, so stay coordinated. Stay coordinated. Okay, I think this is still up. I only probably have to just go over here and then just hit the second portion of this. This is for claim submission. Okay, it should still be up. I'm gonna backtrack back over there. There you go. There you go. So I mean, this is good. Y'all know I'm still learning this part right here. But we're doing claim submission in the medical office. We're going over the paper claims and the 1,500 claims. You know what I did meant to do? Oh man, I'm gonna do it tonight. I did see a UB92 in there. I did see the CMS 1500, the HICFA. But tonight at 6 o'clock, do not forget. Tonight at 6 o'clock, I'm gonna put a UB92 in there, okay? But right now, I have this one for you. So this is today, you guys. This is what we're going to go over. And again, this is YouTube University. You guys remember StreamYard? StreamYard. You guys remember University Streamer that Kai did? Same type of thing. You guys are just not in-house. That's all. Okay. So again, let's go over that. I'm pretty sure that I can't put the whole thing in there, but I'm gonna put as much of this as I can in there. And again, this is what we are going over. Okay. So let's get to this. I'm gonna open up this, and I'm assuming you guys can see what I'm opening. This is medical documentation. This is medical documentation. So I can't literally put the whole thing on, but we're going to put most of it on, and we're just kind of talk about, what's in it. So I'm going to try to put this up here, and it's just a screenshot. We're only going to do the one screenshot of this, and then I'm going to put the rest of it up here. So you say, what are the objectives, Ms. Lambert? It's identify common documents found in the health record, okay? The next thing that I'm going to put me back up because I can't show this for more than, I don't know, what did they say, 30 seconds? So medical documentation, okay, and electronic health record. These are the objectives. The objectives are what you're going to learn in a process, okay, in this class, what you're going to learn in this program. So you have the book. This is what you should be doing. This is what you should be learning, okay? This is called, this is theory. So let's say accreditation came in. Ms. Lambert, what's your theory for medical insurance billing? In my crosswalk, it's this in a nutshell for this class. So this is even for some of you guys that have your program or whatever. This is the rule. This is the rule. How do you know, Ms. Lambert? Because I work at the school. This is what we have to present. Now, objective, identify the most common documents found in the healthcare record. Define the various titles of physicians as they relate to healthcare record documentation. I love that one. Explain the purpose of clinical documentation improvement, CDI. Make sure you take heed to that. Okay. Another objective, identify principles for the retention of healthcare records. That's a tough one. I would say, you know what? If you guys can, do a summary on this one. Abstract information from the healthcare record to complete a life insurance or health insurance application. Okay. Define the various titles. We do that one. The healthcare documentation. Discuss health record systems and list the advantages and disadvantages of an electronic healthcare record system. And some of this we ask in HR. I'm gonna come back. Some of this stuff I do ask people who come in and want to work for the hospital. I ask them some of what I see in the medical insurance billing book. Especially, this is what I always ask: what EHR system have you used? What EMR systems have you used? You see, and sometimes I ask them, can you tell me the difference between the EHR and the EMR system? You see, so sometimes, you do see those things, and, it kind of gives you that heads up about it. Okay. So yeah, you will need some of this as you're going through your CPC. They want you to see some of this. So that's why I have to make sure that some of you who are doing CPC, if you don't know anything about medical insurance billing, you must know something about medical insurance billing, because they will ask you some of this stuff on the CPC. So this is why we kind of breeze through medical insurance billing before we get to your core courses. This on my schedule is called a prerequisite course. Medical insurance billing is a prereq course. Medical terminology is a prereq course. Learning ICD-10 step-by-step is prereq. CPT is also a prereq. Okay, those are prereq courses. Okay, I got to remove this. I don't know how long we got to keep it up there. So some of the stuff we can keep up there. Okay, and I see some of y'all coming in and out. So let's pray that this thing has a good video and audio. Okay, so again, here's your key terms. I'm gonna drop the key terms up here because I want you guys to make sure that you put the key terms on index cards. Put your key terms on index cards. You don't know what they're going to ask you on CPC. It's all about revenue cycle. It's all about revenue cycle when you talk about medical insurance billing. That's revenue cycle. The coding, you talk about a whole different party. No, I'm not going to give you the differences between coding and billing because you're doing those differences right now. You learning the differences between coding and billing right now. I've seen people get like millions of views just saying coding and billing is different. And okay, teach them like you teaching them in a real school. I can't disrespect nobody else's channel. I can't because I watch channels and I see what they do and I praise all of them. They good. I want this channel to be a straight school, a straight YouTube university. That's what this channel is. And I hope that I've already got the okay for some of the books to show these books. I've gotten the okay for John Q to use that movie. So kudos to us. So Sapphire, we got an approval for cinema to use that video. And that video is for insurance purposes. So if you guys didn't get a chance to look at John Q, look at that movie because it's all about insurance to me, to us in revenue cycle management. Watch that movie. So again, I can't keep this up for too long, but you guys go ahead and put that on your index cards. You need to know those terms. You need to know those terms, okay? So I'm just kind of scrolling through the book. Make sure you guys take heed to this. Morbidity and mortality, okay? Modality, 2. But these 2 you will see probably on your exam. Morbidity and mortality. Let me make sure you can see that. I had something like this. One of my students, and she got confused. I got confused too because sometimes you can't tell. You see how those words look the same? If you guys are on your phone, just make it bigger. Morbidity and mortality might give you a fickle. Okay, morbidity and mortality might give you a fickle. So just be careful with that when you see it. Okay. So again, we're in documentation. These are key abbreviations that I want to make sure that you guys know. Make sure that you guys are savvy with this documentation because the AAPC exam, they're going to have you guys know I call the open and close questions the multiple choice. So the multiple choice open and close questions is tell me the meaning of HIV. Tell me what EMR is. This is why I want you to put these on index cards. Put them on index cards and write down what they are. I don't have none in front of me, but so you could just go through them. Okay, this is how you're going to do your study. You got your index card. You don't need Miss Lambert up on a thing. You got all your index cards that I'm telling you what to put on there, and that's how you study. I have a best friend. He now owns buildings. He's now a hire contractor. He and I both went through the same thing when I took my exam and he took his exam. He had 10 crates of index cards. The crazy thing is they work. And he was in the military 20 years and he's dyslexic. And he did it. You will do it. You will do it. You will do it. Just tell yourself you will do it. I got to take this down. So let's keep it moving. We're still in documentation. So in your documentation section, we are in Fordney's Medical Insurance and Billing book for Linda M. Smith. So let's hope that they don't shoot us down for copyrights because we did put this up a few times. But it's pretty much just telling you what you need to do. Documentation process of the healthcare record. The health record is the important tool in clinical care and communication. Documentation is the process of chronological recording pertinent facts and observation about the patient's health. So make sure you guys take heed to that. You guys who've never done billing before, you're going to have fun with this. You're going to have fun with knowing the differences between EHR and EMR. So an electronic health record, or EHR, is a collection of medical information about the past, present, and future of a patient. I can't wait till we do the E&M code, and y'all going to have fun with that. It resides in a centralized electronic system that receives, stores, transmits, retrieves, and links data from many information systems. Okay, I don't need to read the rest of that. Terms EHR and EMR may be used interchangeably. However, They are not the same. The electronic medical record, EMR, is an individual provider record. Epic, got to go back. Can't see myself. Only can see the book when I do that. Epic, Athena. Epic, all hospitals, Athena, the medical hospital. If she goes to that physician office in Atlanta, that physician office has her records. She goes to the hospital in Epic, Athena, records should be in Epic. Epic from New York to Connecticut to Baltimore should have her record. So EHR, I would think of EHR as the big picture. EMR, the medical record, the medical record. So, just be precarious of that when you're getting ready to take your test. I'm going to drop this in the screen. So this is where it is right here. Just be precarious of that. That's in your book. You see this? That's in your book. Okay. I don't know how long I can keep it. I'm not going to keep it up long, but I'm definitely going to ask. But it's just a screenshot. You can put up a screenshot. It's not the actual book. Okay. So we were talking about differences between EHR and EMR. So again, that's in your book. So remember, guys, this is a real medical insurance billing course. I put a lot in this course to give to my students. Y'all remember 5 years ago, the other day I remember that I saw a video when I put in there 5 years ago that I was going to give y'all this class. I'm giving y'all this class. This is for YouTube. If y'all go back through my videos, yeah, I'm gonna crack up when I'll be outside. I'll be outside. Listen, join my YouTube. You wanna learn something? Join my YouTube. Y'all should see I had like a big poster like 5 years ago. I need 1,000 subscribers. Would you like to join my YouTube? Look at some of my videos. That was 4 or 5 years ago. Who'd think I would have 8,000 subscribers? Drive, persistence. Now I said to myself, all right, so I got to be more consistent on here. And guess what? I said I was going to do the free program. This is the free program. I need YouTube to work with me on the program. Okay, so let's go ahead and keep it moving. Okay, I'm just moving down. Moving down in the book. This is a good one right here. So let's share our screen on this one. I don't know if you guys ever heard of that PQR. I'm gonna let you look at that while I'm looking at this, because this was on the exam, and a lot of people don't know that doctors do get incentives when they do their work correctly and they report it. So I only can read this little piece right here, because if I read too much, then we definitely gonna get a copyright. During the last decade, Medicare implemented additional programs such as the Physician Quality Reporting System, PQRS, and the Merit-Based Incentive Payment System, MIPS. These programs link reimbursement directly to the documentation of quality measures like the MU incentives. Failure to adopt these documentation and reporting measures result in reimbursement penalties. Now, this is only if the provider has opted in to this program. The provider does not have to opt into this program. He's doing this on his own free will. You know what? I think all of my stuff is good. I'm gonna put in for that. I've had to do the applications for them. I've had to send the information in for them. So I know all about this. If the doctor doesn't have everything, no, we ain't doing it. The credentialing has to make sure they have everything for that provider, for this provider to opt into this type of service. Okay? So just be precarious of that. I'm going to take it down. So just be precarious of that. And I can see right now I'm already into 38 minutes. This is going to be a long class. Just take heed to it. So yeah, I had to throw that in. So quick review. What is the difference between EMR and EHR? Okay. Quick review. What are the advantages of an EHR over a paper record system? I know you guys know a lot of people who did medical records back in the days, and then they changed to EHR, and a lot of people got terminated. I think that was the worst thing that could have happened. I mean, I wish that they could have done something else. I mean, because this medical records with people careers, looking for records and go pulling them and putting them back and, follow them in the proper pace, proper place. I mean, my cousin was a straight expert at getting medical records, and, bless her soul, they changed the system. And a lot of people, ain't computer savvy, but, That's the worst thing about it. When they make all these changes and people been on the job for years, and they experts at what they do, and then boom, the whole system. Oh, you can't do that no more. We can't. I mean, it's terrible. But anyway, this is what I'm reading from. I just put this up here so I can show you guys what I am reading from. Um, um, what is cloning? Make sure you guys read what is cloning, because that's a new term to me. Make sure you guys read that, because guess what? It's probably on your AAPC. You guys want to look at the AAPC? Go to www.aapc.com and you can actually see the type of stuff that they're going to put on their test. When you go to aapc.com, go find exam education. And on the bottom, it's going to show you what they give on their exam. And now, if you fail the first time, you might get a different test. But when you go on aapc.com, it will show you what they're going to ask you. And this is why we do all 21 points. We do all 21 points because we're not going to just do GYN. We're not going to just do, ophthalmology, a musculoskeletal system. You guys know I have to do it all, because what if you fail one part? It's a shame that you can't take one part. You have to take the whole test again. Whether you want to take it online or take it in person, that's up to you. I would suggest that you go ahead and pay the extra $100 to take your CPC in person. But I have been told that taking your CPC online is better. Taking your CPC online, more people have been passing than in person, which I just can't decipher that, but I guess so. Take your test on Monday, take the other part on Friday. What I would do, take your open and close questions first. Boom, 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 boom. You got 2 minutes for each one of those questions. Now that gives you more time for your bigger cases. It gives you more time for your bigger cases to choose the right answer, to choose that documentation. This is why documentation is important when you are coding. If you guys got your medical insurance billing book, I can't stress it enough. Pay attention to, my nails are disgusting. Pay attention to documentation. Okay, so I'm gonna drop that up there one last time. Okay, so pay attention to documentation. Okay, I'm gonna remove that. All right, so let's go on. So we're still in 3. Okay, we're still in 3, and I just wanted to make sure you guys check that. Okay, so you guys remember those? I gotta put this up. We gotta do like 1 minute, and then I'm gonna tell y'all about it because I ain't supposed to put it up. So you remember what I said? When you see these keywords, these are the answers. Once you read your book, you're going to get the answers. Like I told you, the answer is in the question. The CPC, the answer is in the question. Your medical billing, all those questions are here. They're here. So do not forget that. I can't keep it up too much, but I'm going to tell you what's in there. Attending physician refers to the facility staff who is legally responsible for the care and treatment given to the patient. Okay, I can't do all of them, but I'll do some of them. Oh, this is a good one. Primary care provider. This might be on your exam. Primary care provider is a provider who oversees the care of a patient in a managed health care plan and refers patients to see specialists for services as needed. Let's do this one. Treating or performing provider is a healthcare provider who renders a therapeutic or evaluation service to a patient. Okay. Don't forget this one. We went over this one. Clinical documentation, CDI. All right. So I'm spending too much time on this. I got to backtrack. I know I spent a lot of time on that. So we're still in. Let me just show y'all. We're still here in documentation. I'm gonna put it up. This is where we are. I spent a lot of time on it on the other thing, but I have to stress enough. Get your index cards. Get your index cards. So this is what we are talking about. We're in chapter 3, right, guys? You got your medical insurance billing book, documentation and coding for professional services. 11. Medical documentation, session 13, CPT coding, I'll skip 12, session 12, ICD 10. So now we're getting ready to hit ICD 10, okay? So when you guys get your book, just make sure you do the reading, okay? These are the objectives that you should be going over. Why, Miss Lambert? Because this is in my crosswalk. This is how I teach my class. These are the objectives. And before I do any teaching to my students, I'll have to let them know what we are teaching. Why, Miss Lambert? Because accreditation does not play that. We're teaching online, but you remember Miss Lambert was in her own classroom. You have to show accreditation exactly what you are doing. They need to know, all right, Miss Lambert, well, how long is it going to take you to do all this? Why, how long is your class? How long is your theory? How long is your XYZ? So that's what we do. So of course I can't leave it up too long, but generally identify and describe the alphabetic index and tabular list. Okay, I'm gonna put it up for you guys so you guys can see it. This is what we're going to do. This is our objective. This is ICD 10. Okay, explain the reason for and importance of coding diagnosis. Discuss the history of diagnosis coding. This is what we are learning in this classroom. Discuss the benefit of the ICD 10 coding system and difference between ICD 10 CM and ICD 10 PCS. PCS is procedural coding system. That's hospital procedures. Yes, we do a small portion of that only so that you can identify what that is, or in case it is on your CPC. Okay, identify and describe the alphabetic index and tabular list of the ICD-10 CM coding manual. So make sure you guys do get your books. In order for you to decipher what's going on in some of these chapters, you do need to have your ICD-10, CPT, and your HCPCS. But this is what we're going over right now. I decided to go ahead and move it back in here because some of you are not moving on to your some of you are not moving on to CPC. So if you're going to stick to medical insurance billing, steadfast on your book. You see this book? Steadfast on your book. I'm pulling the books up again because I have to make sure that you guys know which books that you should be getting. So these are the books that we are in right now. If you are not going on to your CPC and you're sticking with medical insurance billing, make sure you use these two books. They got to be by Fortney. Doesn't have to be 2015. These are new. These are new version. Okay. Just get those two books. Okay. So don't forget, we have in class tonight. If some of y'all are already in college, if some of y'all already, did your student loan and you're there and you're learning and you just need that extra bouffoir, subscribe to my channel. You will get the extra bouffoir that you need. Subscribe to my channel. You come to my channel, some students say, well, Ms. Lambert, I'm already in school for medical billing and coding. I'll say, okay, that's fine. Unfortunately, you did get the student loan. I don't know, somebody told me that course was $20,000. This is the same course I'm giving you right now for free. And I said, anytime you need any help, I don't care if you pay or not, I will get you to your CPC. Just call me, just tell me, Ms. Lambert, I am stuck. I want to take my CPC. Subscribe to my channel and you will learn more. You will learn more than they're giving you in the college. It doesn't matter. Anything more than what they're giving you in the college will help you. So I would use Sapphire Education as a tool. Use it as a tool to help you get through the college, to help you get through your medical coding that they are already teaching you in college. Trust me, they're teaching you the same books that I'm giving you right now. Okay, so let's move on. So we are in ICD-10. These are key terms. Okay, so these are your key terms that, let me see, where is it right there? Okay. I'm trying not to put so much up here, but I just hope they don't shut us down. Okay, so it's just a screenshot. These are your key terms. Your key terms here you must know. Adverse effect, benign tumor, chief complaint. What is a chief complaint, guys? The patient comes in, the patient says, what's wrong with him? That is his chief complaint. That is his chief complaint. That might not be his final diagnosis, but that's his chief complaint because he came in and he said, I had a headache. So that's his chief complaint, says that he has a headache. The doctor may determine at the end, I ain't going to say it because I'm superstitious. I ain't going to say it, but the doctor might say it's something else. Okay. But this is what this is. So make sure that you take heed on these key terms. So this is why I made the class Monday all the way to Friday, because between Monday and Friday, you should be working on this. You should be working on this, okay? So in this section, complication, computer-assisted coding, conventions, eponym. Make sure you take heed to the eponyms. Put them on your index cards, okay? Eponyms are pretty much your definitions of what something means, okay? In the shortened version, DTC, FFPs, things like that. Excludes one and excludes two. Oh, Lord, you guys cannot stress that enough. On your CPC, they may say, well, what's the difference between excludes one and excludes two? The basis of passing your CPC is retaining what you are reading. AAPC needs to know, can you decipher the ICD-10? Can you decipher the CPT? Can you decipher the HCPCS? That is the reason for your test. They need to know, can you master this? There's no law that says you better take your CPC or you can't code. I wouldn't hire anybody if that's the case. I hire all the time. My girls don't have their CPC, but my girls can pass an entrance exam. There's no rule that says that they cannot hire you. Meet a good doctor or a good nurse. Hi, good, yeah, that. And she'll let you in. She'll let you in and she will let you perform your coding based on your test that she has given you. Sapphire, I give Sapphire a HIM test. I give them the HIM test before they even release. Because if they don't pass that HIM test that I'm giving them, now I'm afraid they're not going to pass the CPC. God forbid, but if they don't pass the CPC, everybody can come back to me. I guarantee you they're passing that CPC next time. Sometimes it's perseverance. You have to retain what we're giving you. This portion right here that's in the medical insurance billing book, this is the coding portion. That excludes one and excludes two is crucial. Because why, Miss Lambert, it sounds the same. You see right here where it says late effect. Late effects is a residual of a sequela. A sequela is something that happens to you. If you have a car accident yesterday and then 2 months later something happens to you, we call that a sequela. It is called a sequela. It is a late effect of what happened to you. I'm telling you right now, that's on your CPC. Get your index card. I can't stress it enough. Get your index cards. Make sure that you take heed to what I'm giving you. It is going to be on your test. If you've never done medical insurance billing before or coding, I've written about 3 books. Get the book that I've written called. I put that book on YouTube for you guys. This is for YouTube University. It says Medical Insurance Billing Q&A. If mom say, what's that medical insurance billing? Well, how you do that? Tell mom to go on my channel and look for that book that says Medical Billing and Coding Q&A. And that will show mom about what it is. She may want to do it. She may want to do billing and coding or just medical insurance billing. Take mom to my channel and show her the book. I put the book on it, and I had to just scroll through because I had to put it on as a screenshot or a PDF or whatever I did. But show mom how to do that. Okay, so I'm going to kind of scroll down. We're still in that section, but these are things that you must know. Like we just went over the morbidity and mortality, metastasize. You guys see that word? You should be down there too. Metastasize. Let me see. You should be at metastasize. I'm going to put it up in a second. This word right here is a hard word. Metastasize, if you, God forbid, somebody has a cancer and it metastasizes to another part of your body, it's called metastasize. In situ is if somebody has a cancer, right? The cancer is right here. In situ as it's still growing in that area right there. Metastasize, it is metastasizing to another part of your body. Take heed to that. And the reason why I want you to take heed to that, because on your CPC, you must know the differences between metastasize and in situ. We're talking about carcinoma. We're talking about carcinomas, y'all. So making sure you know the difference between metastasize and in situ. Okay. So in this book, you will get abbreviations in regards to those things. So those are the things that I want you to study. Okay, those are just my YouTube students. Those are things that I want you to study. So I'm gonna put this up because these keywords, again, put them on your index cards and make sure you take heed to them. Because again, they're gonna ask you what SNOMED is. So some of you guys know what SNOMED is. Tell me what SNOMED is in my messages over there. Okay. That's a good one. And I have to take that down. I don't know how long I can keep it up. But the SNOMED CT, make sure you read that in this chapter. All of these keywords are what you're going to read. I took it down so you guys can't see it yet. Here's a good one. Diagnosis coding overview. Okay. Don't forget, we're in ICD-10. And I don't know what time it is, but I know I'm getting ready to go past the time. So this might be a 2-hour class, y'all. You know how I am early in the morning. I'm pretty good. Let's just check it back to me. Okay. So diagnosis coding review. This chapter covers diagnostic coding for outpatient professional services and facilities. Healthcare providers and outpatient facilities use diagnosis codes on insurance claims to explain the reason the patient sought healthcare services. Okay. So I don't need to go through the whole book, but make sure you guys take heed to WHO in 1948. WHO developed the official version of the ICD in Geneva, Switzerland. And I know a lot of y'all thought that we did. I'm gonna put this up real quick. I know, to me, I always thought that it originated here, but ICD-10 did not originate in the United States. When we got it from Switzerland, we changed it to ICD-10. Originally, it was just ICD. Miss Lambert, is this going to be on the test? Yep. That's why I want you guys to read those guidelines. Where are the guidelines? I still have them up. I don't know how I can get in there, but remember the guidelines are, you can, if you don't have your ICD-10 book, the guidelines are free on cms.gov. I should have it still up, but I can always share my screen and put that up because that's free. So I'm just going to backtrack and I'm going to share my screen with that. Where is it? So it says share screen, share screen. We talking about ICD-10, so I'm just going to jump into that so I can let you guys see that. Now, I can let you guys see this because this is for everybody. This is for everybody. This is, what's that? There it is. So this is public view. So we are already in, we're in ICD-10, and this is public view. And you guys know I like to share books, ebooks. I love the girls, when they're doing the books and they're trying to show you codes and different things like that. But Ms. Lambert, I'm about to find another way to show you those codes. This is it. If I have a code, we did it last night. If I have a code that I want to show you, I want to be able to highlight it on this computer and show it to you. So y'all know I'm getting ready to master YouTube, right? So, like I said, this YouTube, this is public. There ain't no copyright. This is public. All you have to do is type in cms.gov. ICD-10 guidelines. They will show you. Remember, coding guidelines for ICD-10 is from October to September. Okay, if they want to get specific, when you put this on your index card, put October 1st through September 30th. This is a question on your CPC. They're going to ask you, okay? They are going to ask you what is the year for the ICD-10 guidelines? What is the expansion? What is the when do we get the new one? Okay, so again, this is public, so I can just kind of hang around with this for like a second. But make sure you get this. If you don't have your ICD-10 book, go on CMS and ask for ICD-10. Ask for ICD-10 guidelines. They will give it to you. If you need to start studying that, if those of you who bypass medical billing and you guys are going straight to the core courses, I haven't gotten there yet because we're starting from the beginning to the end. Go ahead and get this because this is going to help you with your test. Ms. Lambert, do I need to pay $2,000 for the school to show me this? No, because YouTube University is giving you this for free. Okay. And it's free anyway. It's online. So you go to school and they tell you, no, you got to get it. No, you don't. If you don't have your ICD-10, go get this first. Okay. So I'm just going to remove that down and we're going to go back. We're going to go back to sharing for the books because we're still going over what we need to go over. And it's fine that you do that because everybody don't have money for books. When you do get like the Chapman Pell and all that, that actually, they should be paying for your books. Your financial aid should be paying for your books. Okay. I mean, well, you still paying for it, but you get a loan or however they do it. Okay. So again, these are diagnosis procedures. They give you, I'm gonna put this up there. They do give you a HCPCS form. I ain't put the other one up there because it's not blank, even though it's just dummy information. But I'm going to still show. I'm going to show you what that form is. This is again, we're still in ICD-10 clinical modification. So on your CPC, they're going to ask you the definition of ICD-10 CM, and you're going to put what the definition is. And in your medical insurance billing book, you can see a little short version of it right there. International Classification of Diseases, 10th revision. Okay, that's what this means. Soon we'll be going on 11, but they don't have any documentation for that right now to hit you guys on. Oh, I forgot this was a screenshot. Okay, so let me go back with that. Okay, so here I think they do show you a copy of a blank HCPCS, which I'm going to show you. This is good right here. When you guys get to this portion, with the ICD-10 and 10. I'm going to show you that right now. Oh, okay, this is it right here. So this is it right here where I wanted to show you guys those official guidelines that's in your medical insurance billing book. So I'm telling you, the Fortney book, I think this woman thought of everything in the world to put in here to teach you how to do medical insurance billing. She had to, because everything is in there. I mean, you get that medical insurance billing book, it takes perseverance in reading. That's what it takes. It takes perseverance in reading. Okay, so we're gonna kind of scroll down. Code also and code first. Oh, I gotta show you that. So this too also might be in your test. Code also and code first. Make sure you go over this. Okay, I can't read it in too much because I don't want it to have the copyright. But just read into code also and code first, because that's going to probably be on your exam. Okay, I don't see that blank HICFA, so I'm going to go ahead and try to get this other HICFA in here. And we're going to just do it for like a second, just so I can give you guys an idea what that 1500 claim form looks like. Those of you who might be working in, if you're working in a doctor's office, this is what it looks like. This is what it looks like in the hospital too, when it's just regular 1500 claim form. The UB92s do not look like this, okay? So we're going to just kind of take that down. And let's move on because we are late. We are late. Okay, so I'm not going to go over ICD-10 anymore. We just did that. Let's just run through CPT. Okay, and these are your objectives on CPT. I'm going to show you your objectives on CPT. So this is the CPT section of your medical insurance billing that you're going to do, and these are your objectives. So this is what Ms. Lambert is looking for you to do. Okay, these are your objectives. Okay, and these objectives will entitle explain the purpose and importance of coding for professional services, discuss the format and content of HCPCS, interpret the meaning of CPT, explain the global surgical package. That's if somebody's delivering a baby, the doctor can't give us 25,000 codes. He got to give us one code. It's all a global package. You're going to get paid for the service that you did. Identify and discuss the evaluation management services, explain various types of code edits, explain correct uses of modifiers and procedure codes, describe various methods of payment by insurance companies. And if you guys can see, you guys notice that's in the billing book. It's in the billing book because it's going to be on your test. Okay, and again, here are your keywords. Those are some of your keywords that you're going to use. I'm going to take it off real quick, but just make sure you take heed to that and those keywords. National Correct Coding Initiative. I'm going to drop it up real quick. And make sure that, again, do your exercises. Do your exercises, okay? When you do a chapter, do your exercises. You do a chapter, do your exercises, okay? This is the CPT portion that we are going over, okay? Make sure you take heed to your RVUs, RBRVs, RVS. Let me see if this thing is changing as I'm changing. It is. So you see this right here? This is going to be on your test. This for sure. NCCI will be on there. RBRVs will be on there. RVs, RVUs. There's a calculation on it that you probably will need to do, but it's still going to be multiple choice. When we get to your core courses in the CPC guide, that first chapter tells you how to do RVUs. And yes, Ms. Lambert, you can bring a calculator when you are doing your CPC. You're supposed to have a calculator when you're doing your CPC because you still got to measure graphs and all that kind of stuff. The whole test is multiple choice, but yes, you still need that. Okay. Oh, this is good right here. I'm going to put this up here only because some people do want to know different aspects of CPC. AAPC has a wide range of tests and exams that they give you. And a lot of times you see a lot of this and people have it under their name. Because when you take one test, you're like dying to test yourself to take another test. So that's why, you see a lot of people with that. I mean, you see them with that. They master every single one of those. They master every single one of those if you see somebody with that. Okay. So when you guys archive this, just take heed to that. Take heed to this right here. Level 2 national codes. I want you guys to pay attention to this. Level 2 national codes developed by CMS. Okay, that might be on your test. Okay, let me go back because I might have to take that down. That might be on your test, so be curious about that. Okay. We already did the HICFA part, so I'm not going to do that again. Um, Again, just read that carefully, okay? Current procedural terminology and format. Okay, so here I'm coming down. I don't know if do I still have it on? Nope. Okay, so let's share. All right, so I'm just getting to the other portion of this. So we're doing session 17, session 14 right now. HCPCS level 2 coding. You guys can see how short this is, right? So it's not a large section. So that's why I think HCPCS is one of the easiest ones that you're going to do, because they're not going to have that many questions on that. Just know that the HCPCS section is your DME section, and you still need to practice it the same way, okay? Understanding the code categories in HCPCS level 2, define the key terms used in HCPCS coding, understand the table of drugs, describe how Medicare reimburses for durable medical equipment and some drugs and biologicals. It looks easy, but it's not that easy. Just take heed to it. Just pay attention to your level 2 and your level 1 codes, okay? Your level 1 is your CPT. This is 2, okay? So these are your key terms. American Medical Association. This is what you're going to read about in this section. Don't forget 4D medical insurance. Durable medical equipment, Medicare administrative contractor. That's MAC, so do not forget that. Okay. Durable medical equipment, prosthetics, orthotics, and supplies. Intramuscular, intravenous. They're going to show you the codes of this, okay? Because when they talk about intravenous and stuff like that, they're talking about the stuff that you're going to use. All that stuff costs money, okay? Prosthesis, temporary codes. I think the HCPCS is kind of fun because there's a lot of stuff in there that you are going to look at in the HCPCS book, okay? So there's not a lot for me to go over with this. Just take heed to the abbreviations and the keywords that you're going to do. I'm just going to do this portion real quick. You probably can't see this. Let me see. I'm going to drop it up there for just a second, just so you can see it. This is what I'm getting ready to go over right now. Level 1 and level 2 real quick, just so you can see what it's about. Where is it? Okay, so Healthcare Common Procedure Coding System. The Healthcare Common Procedure Coding System, take heed to that. That's going to be on your test. Okay, was developed for the Medicare program. Okay, was developed for the Medicare program. All right, the Medicare history consists of 2 levels of coding. Okay, level 1. Let me make sure I got it up there. Oh, I didn't put it up there. All right, so this is what you're going to be going over. Okay, I'm just going to kind of read it real quick and be through. I don't want them to delete this, but this is for educational purposes. Level 1, the American Medical Association Current Procedural Terminology, CPT, codes and modifiers. CPT is used to report professional services and procedures performed. These were discussed in Chapter 13. Level 2, guys, the code and alpha modifiers designed by the Centers for Medicare and Medicaid Services. These codes are used primarily to identify products, supplies, services, including CPT, level 1 codes such as ambulance, durable medical equipment, drugs, supplies, and outside physician offices. Okay, so that's your HCPCS in a nutshell. That's your HCPCS in a nutshell. Do we need to go over this? Yes, this is part of your medical insurance billing. Yes, some of this will be on the test. AAPC wants you to decipher what that is. So yes, that's why we go over that. Okay, so let's kind of keep moving down. Okay, so that's HCPCS in a nutshell. And these are, I can show you this. These are what the codes look like. These are what the codes look like for HCPCS. So I know a lot of people say you still might get 3 or 4 questions. Remember the AAPC, they knocked it down to 100 questions. But you still may have some of these in here. And I just wanted to put this up here just to show you what the HCPCS codes look like. Even though they're not the surgical procedure codes, these things still assist you. And remember, this is for Medicare. This is for Medicare. There is a section in there on Medicaid in the HCPCS book. So just make sure you get that, okay? So, all right. So that is 3, and that's 3 in a nutshell. We are done with chapter 3. Make sure you get your book, do your first chapter, and do your exercises. So let's get rid of this. And now we are going to move on to chapter 4. I knew this would be a much longer chat. I'm hoping that it is good. I'm not doing it again, so I'll be pissed off. So again, we're doing chapter 4 right now. We're moving into chapter 4. And chapter 4 is pretty small. This is for paper claims, CMS 1500 and the electronic claim UB 92. Okay, so this is what we're getting ready to go into right now, and this is quick. You guys make sure you have your book. Make sure you are doing your work. I'm just going to move it over because I can't keep it up all the time. But again, these are the objectives that you're going to do. Identify the circumstances in which paper claims continue to be used. Okay, I'm going to do the screenshot so you guys can see this. Pop. Okay, that's it. uh, Explain the difference between clean, pending, rejected, incomplete, and individual claims, and discuss specific terms used to describe Medicare claims. Now, a clean claim is nothing's wrong with the claim. It's getting ready to go through the clearinghouse, and it's going to be good. Nothing is going to be wrong with it. Okay. Scrub claim is that you have looked through it, you have scrubbed it already. Okay. So when you scrub a claim, that it should be nothing wrong with it. It should go to the clearinghouse, and then the insurance. That should be paid with no problem. I should have 2 weeks turnaround time. We should be getting paid. Okay, we should be getting paid. I have to take it down because I don't know how long I can leave it up. But next, okay, describe the basic guidelines for submitting insurance claim. They might have that on there, but again, you still need to know these things. Explain national provider identification number. Again, we're in the claims portion, so they're telling you stuff that should be on the claim. Okay, demonstrate the ability to complete a CMS 1500. I do have a fill-in claim. Let me show you what that's at the bottom. I do have a fill-in claim for you guys to do. Well, I have it for Sapphire, but you guys can have it for YouTube, okay? Can't have it, but I'll show you how to do it. Okay, so again, these are your clean terms: clean claim, deleted claim, dirty claim. Dirty claim is a claim where something is wrong with it. The code is wrong. The place of service is wrong. The patient date of birth is dirty. It's not going to get paid. Electronic claim is a claim that is electronic. You don't use any paper. We send it straight through here, like Cash App and all that stuff. You send it straight through there. They will get the claim. Okay, there is a provider numbers and insurance numbers that you do need to put in there. I don't know. People are texting me like crazy. National Uniform Claim Committee. Make sure you take heed to this. NUCC, they may ask you what that means. NPI, National Provider Identification, they may ask you what that means. Taxonomy code, suspended claim, state license number, rejected claim. These things are what you will see in this section. On your AAPC, they'll have sections of what you're going to do. They may have 3 questions on that section, 3 questions on that section. Okay, so I want you guys to see this right here. You see that EPSD? Make sure you pay attention to that. What is it? EPSDT. That may be on your test. They may want to know the definition of that. Okay, so let's go ahead and remove that. Let me move on. So here's the blank claim. I think it's okay that I can show you the blank claim. Some of this is in my videos anyway. Okay, so that's the claim that you're going to put this information on. Okay. So just take heed to this chapter. I'm not going to go through the whole thing. A pending or suspended claim, Medicaid claim status, just some of it, and a complete claim. And look, I just want to show you this part. Every question that they give you in this book or that's on your exercise, the answer is in the book. Same thing on the AAPC. The answer is right there in the question. Some people have to be a good multiple choice person. But the answer is in the book. When you take your CPC, the answer is in the case. The answer is in the open and close question. Okay, so take heed to that. Right, you see right here where it says dirty claim, deleted claim. They may ask you what these things are. So don't forget what I said about the dirty claim. The dirty claim is if something is wrong with it. If the code is wrong, the patient date of birth is wrong, if the clearinghouse is kicking it back, if Epic is kicking it back, there's something wrong with it. So we send it back to the billers. Okay, billers, see what's wrong with this. Okay, I got to go check with Siobhan. Siobhan doing the code. Siobhan, what's wrong with the coding? So you see how that chain reaction go? You come from the front end. It's got to go all the way around to that whole 10 cycle. So, just take heed to that, okay? So deleted claim, abstracted record. Okay, so we're finished with that. This is the last session, y'all. So this is, wait, what did I do? Skip it. Okay, so here, I can show you this part. This is where we are. This is the last session of 4. Okay, so I'm just going to remove that. And then now I'm going to go in there, electronic claim. This is what you should be, doing. Okay, after reading this chapter, you should be able to describe an electric claim, define and discuss electric data interchange, explain the purpose of an application. Here it is right here, look. Okay, that's what I'm reading from. Okay, so I can't keep it up too long. They'll say we had it up too long. Define a claim, attach, and discuss. So YouTube, this is for my YouTube students. This is what you should be working on this week. Okay, this is what you're working on. You should be able to tell me, define claim attachment and discuss claim attachment standards. Name and discuss some methods of interactive computer transaction for transmitting. I can even say insurance claims. Okay, discuss interactive transaction and relate the electronic funds transfer process and mandated requirements under the Affordable Care Act. Tell me, when was the Affordable Care Act enacted? That's on your test, okay? That's on your test. So I don't know if it's moving up, but this is where we're at right now. Take heed to this. These are your key terms, okay? These are your key terms. So this is a pretty short portion right here. The electronic claim. This chapter will focus on the submission of electronic claims for professional services. Okay. The federal government has implemented policies through the Administrative Simplification Compliance, that's ASA Act, that require providers to submit claims electronically unless they have a waiver on file. So this is excellent. Make sure you take heed to this case right here, because remember, we do paper claims all the time. One time, I think I did all of my claims in Medicaid on paper. They all had to come back. Then all of a sudden they had this machine. You had to do it online. I'm telling you, when they transitioned to all this electronic stuff, we all was in turmoil. It was like the whole office was like, faculty practice was, back in the days, you're talking about 19, I don't know, when did I join faculty practice? 1999 and 2000. Way back then, it was old school. Everything was done on paper. There's even cases where you had to take Medicaid cases and literally write out Medicaid charges, and we literally had to physically mail it in. It wasn't no machine that was popping out claims and mailing them. We literally had to mail it in. But now, that's why the workforce for billing has to have been reduced, because we used to do all that stuff straight manual. It wasn't no electronic claim submission. So, that's from word from the wise. I mean, you talk about 25 years ago when we used to do that. Hard labor. You ain't doing nothing in coding now. The hardest thing you're going to do in coding is pass the test. That's the hardest thing you're going to do, is pass the test. I can't wait till we get up to those core courses. All right, so let's take that off before they boot us out and say we got too much. We put this up too much. All right, so I'm just going to put this one up real quick. Healthcare organization, computer system, insurance carrier, computer system, healthcare claims. So look at this. This is actually how it go. This is the computer system. Let's say this is Epic. This is the clearinghouse. This is the insurance. The clearinghouse need to check it first. They need to check these insurance claims before it head over here. That's what they paid them for. Okay, I can't keep it up too long. I'm going to take it down. Okay, so that's the case. Transmission of electronic claims. Clearinghouse. Healthcare organizations that do not have an accounts receivable management system capable of sending electronic claims will often use a clearinghouse. People who do will still use the clearinghouse because they check. A clearinghouse is a private company that collects data, converts the data into HIPAA, Health Information Portability Accountable Act. Don't say HRPPA. I'm going to get all y'all. Standard, because that's on your CPC. Standard transactions, and then processes and distributes claims for its clients. I can't read no more. They're already going to get us. I don't know if they're going to let us keep our video up or not, because I did probably go overboard. I'm pretty sure I went overboard in showing you guys stuff. But it's you know what I'm saying? I mean, it is what it is. And number one, if this is live and y'all got this, Okay. Hopefully they don't delete the stuff that I put up there, because I did put a lot of stuff up there. But again, this chat is over. We're done. I'm gonna throw this in there. Audit trail. Watch the audit trail. That's everything that went on with that claim. Advantages of electronic claim submission. I know y'all see how I get carried away. It's time for us to stop. But let me just put this one in here real quick. I'm put this one in here. Let me let y'all see this. Because y'all know I get carried away. I gotta end the chat, but I still want y'all to see this. So make sure you take heed to this. So some of y'all who are staying in medical billing and you're not going on to coding, the standard form NSF, make sure you know what that means. I got to go back and look at it because I can't see it. Okay. I'm going to read this first part. Transaction and code set regulations, streaming electronic data exchange under HIPAA Title II, Administrative Simplification, the Secretary of Department of Health and Human Services. Make sure you know what DHS mean. Make sure you know what National Standard Format, SSF, SSF, whatever you say it. They're going to ask that. Okay. Automatic teller machine. Make sure you know what that means. A lot of us don't even know what ATM means. We just know it's ATM. But these are things that you need to know. Okay, I got to take it down. They're going to get me for doing all this. Okay, so that is the end of this review for today. Remember, tonight we are going over this again. Okay, so that y'all got 8-9 hours before 6 o'clock before y'all have to go over this. Okay, so just remember, okay, I'm dropping this up because I'm just putting up the books that you need for the chapters that we are going through now. We are doing medical insurance billing. Okay, this is a free program. This is a free training. Okay, if you want the courses that I teach, go to sapphirecoding.com. This is for my school in general. I have an online virtual school. I teach them the same thing. The only difference is they have material for me. They have tests. They have one-on-ones. You too, we cannot do all of that with you, but I still can give you this type of free training. Okay, but you can go to sapphirecoding.com. Click on bookstore. That will take you to the bookstore. If you do not see it or if you have an issue, let me know. I will take you right to the bookstore. Okay, you can purchase courses from there. You have a key code. I'm giving it to you right now. If you stuck in till all the way hour and 22, this is a key code for $1,150 off of that program. Hashtag key 212. Remember it. Hashtag key 212. That's $1,150 off. If you want to join Sapphire Physician Coding, you can stick to YouTube. That's fine. But that's the hashtag code to get that $1,150 off. Okay. So we have had a wonderful session. All the sessions are good. And I'm trying to think of what I did not put in here that I put in here last night. I'm pretty sure stuff that I put in here that I didn't put in last night. I didn't put a lot of the illustrations in there because we really didn't do illustrations, but I did want y'all to see some of the illustrations. I'm gonna try to put this one in here real quick. Let's go here real quick. Stop the screen share. Present share screen. When I just want to put this in here because sometimes when I be talking about illustrations, y'all don't know what I be talking about when I be talking about illustrations. But this is what I'm talking about illustrations. I'm gonna go all the way up. I don't know why I'm all the way down there. Let's go to illustrations. Hold on, guys. Illustrations. All right. So this is what the illustrations are, and the illustrations are anatomy of the body. Okay, stuff like this. These are the things that I told y'all that I want. Where's that? These are the things I told y'all that I want y'all to remember. Okay, these are like illustrations. Illustrations are, body systems. And look, you have enough room to put notes in. You have enough room to put notes right there. I'm just going to go to it real quick. And remember, you can get this book from Elsevier. Okay, this is the Bucks book. It's not as much as the other books, but you have the same stuff in them. Again, here's an illustration of lymph vessel nodes. They're showing you where the schematic demarcation of dermatomes. I don't know what that is, but we read up on it, we'll know. The L disc, posterior and anterior. Okay, I think you guys can see this. Oh, wait, hold on. Some of this stuff I can't show because it's a little bit ridiculous. But it's not ridiculous, but it's invasive. No, I can't show you that. Y'all know I always like to show the eye. So I'm going to the eye so I can show you the eye, because 9 times out of 10, the sclera, conjunctiva, all will be on your exam. AAPC is going to ask you about this stuff. Okay, that book right there, that's your book. Okay, that's the ICD-10 book. Okay, don't forget, you can get that from Elsevier with 25% off. Tell them what my school is. I have a real school. Tell them what my virtual school is. And I have to check those. Tell them what the virtual school is, and they should give you 25% off. At least that's what they told me. If they say, you know how you do a drop down and you say what school you go to, you should be able to pick it, and they will tell you. Okay, but again, these are illustrations that I want you to watch. So you also see lens, canal, artery, macula, retina, choroid. Just you guys make index cards with these. Okay, make index cards with them. Let me see what else is here that I can just kind of look at real quick. Nothing invasive. Okay, again, these are illustrations. Okay, especially this one. Take heed to this one. You see where it's telling you where the glands are, limbus and cilia and all that kind of stuff. Y'all know cilia is a hair. Okay, let me go back because I can't put another pictures. It's too invasive. Okay. Okay, I'm scrolling, but you can't see me scroll. I'm gonna put the ear up there. Oh, this is a good one. This is a good one. See, we kind of jumped over to ICD-10 because we were still, because that's the section that we're on. So that's the only reason why I wanted to kind of pull some of this in here to kind of show you this. And again, it's just a screenshot. It's just a screenshot. And again, it's still learning. I don't see any reason why they should flag us with the illustrations that I'm putting up here. But these are the kind of things I want you to take heed to, because these, again, are illustrations. The illustrations will be on your exam. They will be asking about that, okay? So I'm just going to remove that because I don't want us to get a copyright strike. But okay, so I'm not going to do any more of that. You guys are going to read that, and we're going to shut this down. So if you guys have any questions, let me know. I know I've got a thing going on. You guys let me know, and I will answer you. If you're at work and you have questions, let me know. I will answer you. Send me a message down below. Again, you guys can check out my website, sapphirecoding.com. And I will get back to you. If you want to just look at the courses that I have, you can. And these are courses that you just buy they're going to keep you on track. It's really the course. So this is how I do my course. So my training that I'm giving you, they get the same. They have to look at this video too. They get the same thing, but they have the courses. They have the courses that's giving them the work step by step of what they're supposed to do. Okay. So you guys let me know if you have any questions, okay? And if you want to get those courses, again, sapphirecoding.com, go to the bookstore. Okay, I'm ending this chat, and I will see you tonight at 6 o'clock.